So if a job tells me I need to have 5 years experience and I only have 2, I'm still going to apply. Because it's not my job to tell me that I'm not qualified. I think I can do it, so I'm going to apply for it. Hello, and welcome back to another video. If you're new here, my name is Ebony, and today I am basically sharing my experience as a clinical research professional, more specifically in project management. About a month or two ago, I posted a video about a day in the life of a clinical project manager, and I'll have that linked above or down below. And I got a couple of questions about like what I do, how do I get into it, what did I do to get a job, like stuff like that. And so I thought it'd be nice to go ahead and answer so many of those questions and a little bit more all in one video. So I have my computer here. I did like a deep dive on like my background and like things that people may want to know and like what I wanted to know when I was getting into this field. So let's go ahead and get into the first topic. If you're not familiar with clinical research, I'm going to give you the professional medical definition of what clinical research is, and I have it right here on my computer. So clinical research is a branch of healthcare science where we help with developing and researching new pharmaceutical drugs, medical devices, essentially in hopes that they go to market to help with treatment, diagnoses, providing an alternative option for different treatments, prevention, essentially all for human use. Clinical research is a field where it's very diversified. There's so many different avenues. There's people that do marketing, there's people that do branding, there's people that do safety, there's people that do medical monitoring, clinical monitoring, there's people that do finance, contracts, there's HR, like there's so many opportunities available in clinical research. But today we're just getting into my experience and doing more specifically like project management. So I just wanted to give you like an overall definition of what clinical research is. But as far as like my day-to-day goes as a project manager, I offer oversight to my internal team at my company. I also do oversight for the sites that are participating in our research studies and oversight for our clients as well, kind of reassuring them that we're following the steps that are needed by the government, but also sometimes we work with clients that are completely new to the industry. This is their first time doing it, so you kind of have to give them a little bit more hand-holding as well. So that's something that I do as well. I also have to do a little bit of finances in this role, so I have to review contracts, review budgets, negotiating contracts and budgets. I have to do vendor management and sourcing out, getting our resources in line that will not exceed our budget and that we'll be able to kind of use them throughout the study, for example. Leading meetings, creating meeting agendas, doing follow-ups with different team members. I help with safety meetings as well, so preparing to go to the safety committees to get approval. I do a little bit of data management, data reconciliation. I do kind of like a lot. It kind of just depends on where I am and what's needed. Also, some important things that I do is like creating project timelines, reminding the team of the project timelines, and then also I would say delegating tasks and reminding people of their task is very much so a key task as a project manager. So that's just like what my day-to-day is. But let's go ahead and get into my work experience in education. So I have a Bachelor of Science in interdisciplinary studies. I did animal behavior, psychology, and a minor in bio. Originally when I was going to college, I was really very much so all over. But I knew I liked science, so that's what I did as my bachelor's program. And then for my master's, I have a Master of Science in Healthcare Administration. Do I feel as though my degrees were required for the work that I do now? No. I don't feel like I needed those degrees. I need these degrees to do the work that I do now. I know some companies just require you to have degrees, so I mean, it comes in handy that I have too. But as far as like, do I refer back to what I learned in school? I would say no. So, but I know there's people that do project management and they major in business administration. They do psychology, or they do bio or chem, or they do communication. So I wouldn't say you need to limit yourself to a particular degree in order to be a project manager, but also if you kind of know what part of the industry you want to be in, it's always nice to kind of get that background. As far as like certificates go, I don't hold any certifications in anything, but I did make a list of a couple that are available. So as a project manager, you can work with the Project Management Institute, or PMI, to get the Prestige Project Management Professional Certificate, or your PMP. And then there's also like a Certified Associate Project Manager, I think it's called a CAPM certificate. And then of course, Google has their project management certificate as well. None of these are free. So let me just go ahead and get that out the way. I know like it's like a rumor going along that Google is free. It's not free. You get a free trial for like a week, and then you can apply for scholarships. I think it's like $39 per course, if I'm correct, because you don't get the whole thing for a flat rate. You keep, like if I applied for the scholarship a couple of times and I had to keep reapplying for the scholarship, but that's a whole other thing. A couple of other certifications are related to associations that are specific for clinical research. And so there is SOCRA, which is the Society of Clinical Research Associates, and they do a CCRP exam, which is a Certified Clinical Research Professional. So essentially that's for anyone that works in clinical research. It doesn't have to be tailored down to exactly what department you're in or what niche you're in of clinical research. It's just kind of like a flat exam that covers all the different aspects. And then there's the ACRP, Association of Clinical Research Professionals, and they have a multitude of exams that you can take. There's one for just certified clinical research professionals. There's one for research coordinators. There's one for clinical research project managers, and then there's some for like clinical research associates. It's just so many different opportunities. But personally, I never sought out any exams at ACRP just because I wasn't sure exactly where I wanted to land in clinical research, and I still don't know what the future holds. So when I was speaking to my mentor about it, she was recommending the SOCRA exam just because it's kind of like a flat, not a flat rate, but like a flat experience, I guess. Flat exposure exam. I don't know what word goes there, but essentially like an exam that covers all the different pieces of clinical research. For me, I think those are very valuable because you kind of get more like in depth with what goes on day to day. Like you're tested on the laws and the regulations of clinical research. You're tested on the history of clinical research. You're tested on the regulations. And as you know, like the regulations and FDA rules and laws are very strict when it comes to clinical research, given the history of what's happened to many people in clinical research. So I think that those exams are really helpful in preparing you for the industry, because you also, I feel like it gives you a good idea of what to expect and what's required when going through and navigating your different projects in clinical research. Moving on to my work experience. So I've been in clinical research for 6 years. I've been in project management for 3 years, but prior to getting into clinical research, I've always had customer service and administrative based jobs. So throughout college, I worked as an assistant manager at a spa, so that included finance, budgeting, HR, marketing, sales, like a lot of customer service, obviously, which is very important when doing clinical research as well, because you are essentially working with a client or a sponsor, which is essentially like a pharmaceutical or medical device company. So a couple that you guys may be familiar with is like Johnson & Johnson, Bayer, Pfizer you've heard of, Moderna you've heard of. So just a couple like the big names to throw out there. They would essentially be like your clients or your sponsors. So having customer service skills is a very, very important thing to have, as well as communication. And so for me, when I graduated college, since I didn't have any idea what I wanted to do after getting my bachelor's, I was just like, I just need a job that's going to pay me well, that I can pay back these student loans. And so eventually I found a role in clinical research as a clinical administrative assistant. And so I did that for a year, and then I got moved into a more hands-on role where I was working with those that participated in clinical research as people that volunteer for it. And then I got to work more with like the doctors and the nurses, more of like the regulatory team, the data management team, like kind of essentially more of the key stakeholders in clinical research. And so then I did that role, and that was called a clinical research administrator. What was it called? Let me see. A patient coordinator role. Clinical patient coordinator, something like that. But I did that for a year and a half, 2 years, and then I kind of hit that wall that there was no more growth within that company. And so I left and I moved to North Carolina, and then I became an oncology clinical research coordinator, and I did that for a year. And then I realized that after essentially 3.5 years of working directly with the participants, I kind of just wanted to kind of get in the back seat a little bit and a little bit further away from that. And so then that's when I started applying for roles in project management. So at that point when I was applying for roles, I already had about 3.5, 4 years of clinical research experience. I had about a year of project management experience because in my role as an oncology clinical research coordinator, I was the sole contact and point person for that study at the entire company. So I had to do all of my own IRB submissions. I had to do all of my regulatory documents. I had to host all of my audits when people came to do audits on the study. I had to, of course, run the study, seek the patients, follow up with them, order their testing. Like I had to do both, maintaining my study, oversight for my study, and conducting the study. I had to do all of it by myself. So it was a great experience, but it wasn't enough to pay the bills. So essentially I job hopped again, and I got my first official title as a project specialist. And so in that role, I was basically a support for the project manager on the study. And I did that for about a year and a half. And I feel like when you're working in project management, there's so many opportunities to grow, like in a sense of like or growth and exposure. So for me, I really still didn't know exactly where I wanted to stay in clinical research. I was like, well, I don't know if I want to stay in project management, or do I want to go over to clinical monitoring and be a monitor and travel? Do I want to do data management, be behind the scenes a little bit more? But project management really picked up for me, and I was just really good at it, so I stayed with it. And so essentially I did that role for a year and a half, and then I moved into the role that I'm in now as a project manager, and that's where I am now. So I've been doing project management at this company for about 6 months now, and it's very, very different than where I was before. Not different in the sense of the work, different in the sense of like the company. Like I really enjoy the company that I work for, and so that's my experience with working and everything. For me, I would say always ask questions, always ask if you can sit in on things. Like for me, going to project management, I still felt like I was kind of new to clinical research because I was just so used to being at the site level and only working with the volunteers and the participants, that there's so much more going on above head that I had no idea. And even now, I still ask to sit in different meetings and watch other people like do their work essentially, or shadow, or whatever the case is, just because like there's just so much to learn still. And so for me, I would always say, like, if you're trying to get into project management or you're kind of just looking to get exposure for it, like ask those around you if you can sit in on a meeting or sit in and watch them do something, or if they pick you up as a mentee or whatever the case is. Just always ask questions and look for opportunities. And then I would say make sure you have a strong sense of self and like a good boundary, because I feel like you can go from just wanting to sit in and get experience and exposure to all of a sudden this is becoming your task and this is now your job, when you're not like actually being compensated for that and that's not your role. So just be mindful of that and considerate of yourself on how much you're taking on. Like I know for me, after a while I did start to take on a lot more tasks because I just wanted to start doing it and get more familiar with it. But after it started to become the norm for me to start doing it without any compensation, or just taking other people's work and them not doing it and just falling on me, I kind of had to like set that boundary for myself. So I would just say make sure you have strong boundaries, but also put yourself out there so you can get experience in different things. So working in clinical research, there's different aspects of it as far as like, well, let me change that, not aspects, there's different environments that you can work in. So you can work for a sponsor or a client, also known as like the pharmaceutical or medical device company. They're the people that are looking to conduct the research. And then there's the people that are like at or contract research organizations, and they're the ones that are contracted to run the study for you, because essentially they usually have a little bit more insight, a little bit more experience and education when it comes to conducting clinical research studies. So a sponsor would typically go to a clinical research organization and they'll work together to complete the study. And then there's also the site level, where you're the site that is conducting the research hands-on with the volunteers or the participants. And then so essentially you're doing like the day-to-day, so like you're doing the blood pressure, you're administering the IP, I'm saying the lingo as if you guys know, you're administering the investigative product or administering the medical device, you're doing their vital signs, you're following up with them to see how they're feeling, checking in on them as far as safety, things like that. So for me, I've done working at a clinical research and I've done working at the site level. I have not worked for a sponsor or a client just yet, but I've had great experiences and not so great experiences, but it kind of just depends on what you're looking for in regards to work-life balance, salary, environment. So all those things are like important to take into consideration when deciding on which one you want to start with or where you want to work at. For me, I found that it was pretty easy to get in my foot in the door at the site level, just because I didn't have to have really any experience for the role that I started with, just admin experience, and that's super easy to get. We all use the computer at this point, so it's not too hard to kind of just get your foot in the door that way. I want to talk about the skills that are like on my resume and skills that you need to be a good clinical research project manager or a project manager in general. For me, I would say the top one would probably be time management. Depending on how heavy your workload is, like every project requires a different amount of availability or FTE to complete. So sometimes you may just have one because it needs all of your time, like your entire 40 hours for that week. Sometimes you may have 3, sometimes you may have 4. I've had 5 at once. It kind of just depends on what the requirements are for that study. But it's really important that you have good time management skills, because so many things are going to overlap, so many deadlines are going to overlap, and you just kind of have to be on top of it and be aware of what you need to get done and when. And if someone else is depending on what you do to do their work, you really want to be on top of your stuff. I would also say communication is super important, because one, we're working in a remote world for the most part now, where so many things can get lost in translation. You need to be able to talk to different people in different levels. You want to come to your meetings and to your calls and talk to your clients very professionally, very well educated. And if you don't know the answer to a question, it is nothing to be ashamed of. You just say, I can follow up on that. I will get more details. I will reach out to such and such, whatever the case is. Just always put your best foot forward and just communicate. I would definitely never say, like, never misrepresent yourself or your abilities in regards to what you know in research, because it can definitely come back for you. So always be honest. It's important to be a critical thinker and a problem solver, because so many things can come up in research. Just like in your day-to-day life, expect the unexpected. An audit can happen, or a site could lose power and their investigation or product gets damaged. Just anything can happen. And so because anything that can happen, you also have to be able to do risk management as well. So identifying risk, having a plan in place in case that risk happens, or being able to navigate them accordingly, so that way you're staying on track and you're staying in compliance. Also, I would say leadership skills as well. You just want your team to respect you and being able to look towards you for guidance as a leader. And so for me, I just think it's really important to communicate to my team, like, what they need or what I need from them, ask them what they need from me, how I can support them, where they're standing with their tasks, do they need additional resources or additional support. Just being very open and communicative with your team is really important when building leadership. Also, giving accolades as well. Like, I feel like so many people in leadership roles, when you're not doing well or someone's not doing well, they just like hone in on that. But like, people need like accolades and pats on the back as well. So for me, in my current role or my current company, we're able to like submit like accolades to the team, and like they get like a gift card or whatever for it. So like when someone's doing really well or someone's really helpful or they're just doing above and beyond work, I always submit something for them, because I just feel like it's really great to be recognized, and I think it's really good when like a leader of a team recognizes your good work as well. So I got a question about work-life balance, and for me, I would say my work-life balance is a lot better in my current role and company than I've had in previous roles. Having strong boundaries is super, super important. Like, I can't stress that enough. Like, for me, I know my work hours. I have them set, I have them communicated to my team. I'm not available after a certain time. I'm not available on weekends. I'm not available while I'm out of office, like, because I just feel like setting those boundaries is what allows me to perform my best. Now, I completely get that sometimes meetings run over and I may have to work till 5:30. Or I get that sometimes meetings start early and I have to log on and be ready for a meeting at 8 a.m. or 8:30. That's completely fine. I just plan in advance for that. So I would say things that contribute to like your work-life balance would be setting your own boundaries, communicating to your team, communicating to your leadership what your needs are and what you're struggling with. I would also say like your work environment matters as well. Like for me, my company is very big on wellness and mental health. So we get a mental health day every year. They compensate or provide reimbursement for any wellness venture you want to participate in. So if you want to get like a meditation app, you want to get your gym membership paid for, your Pilates paid for. We also get free mental health services through Modern Health. So not just through your like EAP, like your employee assistant program, but like a true therapist and life coach. We get sessions for that every year as well. And then, so those things are kind of like important to me. And that's kind of like having those benefits available kind of reminds me that I need to be putting myself first in order to perform well at work. And then I would also say that creating a to-do list and a schedule for myself is really important. So at the start of each week, I write down what I need to get done this week, what's happening this week, what's due this week. And then at the beginning of each day, I write down what I need to do that day. I block off time on my calendar. Like if I have a day and I have like 5 meetings and they're an hour each, I block off the rest of my calendar, because how are you going to get any work done if you're in meetings all day? Besides, we all need a break. Speaking of breaks, make sure you're taking your breaks, okay? It's so important in having a healthy work-life balance. Like, take your 30-minute lunch break, or if you do an hour lunch break, whatever you're allowed to have, take your 2 15-minute breaks, go out for a walk, enjoy a meal with a friend, read your book, walk your dog, cuddle with your cat, whatever the case is. Just make sure you're taking your breaks and recharging, because I can promise you that if you're not taking care of yourself, you're not going to be good to anyone or anything else in your life. Please make sure that you're always prioritizing yourself, no matter what role you're in, what company you work for, whatever the case is. It's just super, super, super important that you're prioritizing your mental health, listening to your body, listening to your mind, realizing when something's not right, and just realizing that the work will be there in 5 minutes. If you decide to take a break, it is okay. So you're able to, like when I have downtime, like for example, say a couple of my meetings got canceled for the day that I was expecting to have, I would use that time to kind of get ahead on my other projects and tasks that I have. And then, so again, that kind of like loops back to time management skills. And then I would also have one here, advocate for yourself. I'm over here pointing to the screens if you guys can see it, but I also have one here, advocating for myself, because I mean, who's going to advocate for you but you, right? So I would say speak up. Like if you have too much work, speak up if you feel like you don't have enough work, or speak up if you feel like you need additional support on something, or you just need help. Like speak to your team, speak to your counterpart, speak to your leadership or your line manager. Just like be very open and communicative about what your needs are and where you stand. You do not have to suffer alone. And if you are at a company where you feel like you have to suffer through everything that's going on, then they may not be a good fit for you. Just saying. But do with that information what you will. But for me, having a work-life balance is just so important, because it can kind of spill over into your personal life. Like, let's normalize the idea and the concept that rest does not need to be earned, okay? It is a requirement. That's like my mantra, like rest is a requirement, okay? So just keep that in mind. All right, now that we've covered so many topics, I just want to get into one last thing before we close out the video, and that is all about like getting the job, your job hunt, and looking for work. So if you're looking for clinical project management roles and clinical research, I would say like I would say a couple of titles to look for would be project assistant, junior project manager, associate project manager, clinical research manager, clinical project manager, clinical project lead, clinical project leader. It's just so many spins and twists on the names of roles in project management that I wouldn't want you to miss out on any. And then if I can think of any more, I'll put them down in the description box as well. That way you can kind of use this as keywords to search for your different roles. A couple of tips I have would be ensuring that your resume is up to date and that it's a true depiction of who you are, your experience, and what you have to offer. One of my things that I like to do when updating my resume is I like to look at the job descriptions for the other roles in my company. So one, because that just gives me an idea of things that I do that may actually not be in my current job description that I can now add as a part of my work experience. And then sometimes there's a better way to word your resume than just putting, I don't know, takes notes in meetings or answers phones or whatever the case is. Like there's a way to kind of present that information and execute your delivery better. Another thing that I like to do is ensure that all of my skills, especially your transferable skills when you're coming from a different industry, are listed and kind of stand out in my resume. And then once you get the job, let me back up. Before you even get the job, once you do all of that and you do your research about the companies, the role, I would say shoot your shot. We're shooting all of our shots, okay? Like my thing that I believe in is that it's not like it's not my job to tell me that I'm not qualified. I'm not an HR professional, okay? I work in clinical research and that's what I want to do. So if a job tells me I need to have 5 years experience and I only have 2, I'm still going to apply. Because it's not my job to tell me that I'm not qualified. I think I can do it, so I'm gonna apply for it. So I advise you guys to take that same advice and don't get discouraged based on education requirements or experience. Like so many companies are willing to take you in, to take a bet on you, to take a risk on you, or whatever you call it. So many companies are willing to take a chance on you and to work with you because they feel like they're investing in you. And if you can prove that you're like a hard worker and you're ready to learn and you're ready to grow, you can most likely get the job. So shoot your shot. Shoot your shot. No matter what the title is, no matter just shoot your shot. I promise you, you will not regret it. Shoot your shot, okay? Remember, you're not the HR professional here. It is not your job to tell yourself that you're not qualified. That's the HR's team, okay? That's their job. So shoot your shot. But once you shoot your shot and you get the job offer, make sure you're negotiating your salary and all of your benefits, because so many people go into a role and they get a salary and they're like, wow, this is so much more than I was making before. Yes, but salaries have a bandwidth and you know your worth. Like, it's just the first offer. Always take it back to the table and negotiate. You can always get an extra 5K, you can get an extra 10. You never know. You really never know what you can get. For me, there was a role where I was leaving and I had unlimited PTO, and then I was able to get an additional week of PTO. So usually the company, like your first year, you get 2 weeks of PTO, and I was able to get an extra week of PTO. So I got 3 weeks without having to do my 2 years of service. Plus on top of that, it was a great raise and I negotiated, so I was able to get like $30,000 more. Shoot your shot. Make sure after you shoot your shot that you're still advocating for yourself. So even if you're like negotiating flex time, you're negotiating educational benefits, you're negotiating a remote or a hybrid environment, Whatever the case is, just make sure like you're able to advocate for yourself and make sure that you're getting your needs from your company. You're not just only servicing them. And then last but not least, I feel like so many of us, me included, struggle with imposter syndrome when we're getting into new roles, unfamiliar territory, or essentially being challenged in a way that we haven't before. So I would say like we should embrace it. We should acknowledge that it's there. Imposter syndrome is there. It happens. But I think that it's so important to remind yourself that you would not be in the room, you would not be a part of the conversation, you wouldn't be included if you weren't qualified or worthy of being there. So it's okay to feel nervous. Like I still get jitters when I lead certain calls with certain clients or new people or new team members. Sometimes I get nervous when I have to do presentations for people that I've never done before. Like I still get nervous, I still get butterflies, I still feel like I can't do stuff and end up knocking it out the park every time when I get my feedback. So acknowledge that the imposter syndrome is there if you suffer with it, but remember, like you're qualified to be there. You're qualified to be there. You're worthy of being there. And if you don't do well, guess what? There's always next time. You get your feedback from your team. You take that. You work on yourself. You practice. You research. You do what you need to do to make yourself better. And then you go knock it out the park the next time. Okay? So keep that in mind. So I think I've covered everything that I wanted to cover for you guys. I know this video is pretty long. If you have any additional questions, please leave them down in the comments. I'll be happy to answer them. And if you guys are looking for a part 2, I am more than happy to do one, but just let me know what you need. I hope you guys really enjoyed this video and found it helpful. I will see you guys in the next one. Bye.